Joined now by our friend Dr. Ashish Jha, Dean of the Brown University School of Public Health. Welcome back, Dr. Jha. Let's pick up where Eva left off. You've been sounding the alarm about the situation in India. The Biden administration is now stepping up. PPE and vaccines are going to be sent. What more needs to be done? What are the consequences if we don't?
Yeah, good morning, George. Thanks for having me on. Things in India, as you heard, really terrible situation. We really need to help. Other countries are also stepping up. Oxygen is necessary, medicines, testing kits. There's a whole set of things that India needs in the short run. We've got to help India get this under control. If it spirals out of control in India, it's going to be horrible for India. Of course, it will have huge implications for the whole world.
Let's talk about the situation here at home, where we know the CDC is going to put out that guidance on outdoor mask mandates. What makes sense right now?
Yeah, I think we're going to see a pulling back of the mandates. I think certainly when you're outside, out and about, unless you're in large, crowded groups, there's really very, very little risk of being outdoors. So I think the CDC is going to signal that. I think we're going to see a lot of states pull back mask mandates, except for those very specific situations. Indoor masks need to continue for a little bit longer, but I think that it makes sense to pull back the outdoor mask mandates.
On vaccinations, we're getting to the hard part now, just getting to the population that just doesn't want to get that vaccine, people skipping their second dose. What's the best way to reach those people who are still hesitant?
Yeah, George, my sense is there's a lot of people out there who are okay to get the vaccine, but it's still hard to get it for them. I mean, they still feel like they have to jump through hoops or they have to sign up in a way that's not easy. So I think the ground game right now has got to be all about making it super, super easy for people to get vaccinated. Vaccines into doctors' offices, walk-in clinics. You should be able to just pop into your local CVS or Walgreens and get it. There's a lot of work. And then, of course, we still have to do the messaging of addressing concerns people have. I think if we continue working on those things, I bet a whole lot more people will get vaccinated. A vast majority of Americans will end up getting vaccinated.
What about paying people to get vaccines like we're seeing in West Virginia?
I think it's a creative idea. You know, I hadn't thought that we would need to, but there are some people for whom it could be the inducement. And so I'm totally fine with it. There's clearly a huge social benefit of getting vaccinated. It's good for you. It's good for others. If there's a little payment involved in it, I think it's probably fine.
Dr. Jha, thanks for your time and your information this morning.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.